Hello, my name is Joachim Zuther. I'm the founder and educational director of the Academy of Lymphatic Studies. And today I would like to explain the importance of using quality compression garments for the treatment and management of lymphedema. As many of you know, patients affected by lymphedema graduate from compression bandages that are in the majority of cases applied by a trained and certified lymphedema therapist to elastic compression garments once the affected body part is decongested. This stage is also known as phase 2 of complete decongestive therapy or the self-management phase. Phase 2 is an ongoing and individualized part of complete decongestive therapy in which the patient assumes responsibility for maintaining and improving the treatment results achieved in phase 1. In phase 2, compression sleeves or stockings have to be worn throughout the day and become part of a patient's life, much like hearing aids or eyeglasses, and along with self-manual lymph drainage, skin care, and exercises, compression garments play a major part in this phase of the treatment. Properly fitted and comfortable compression garments prevent the reaccumulation of fluid and preserve the treatment success achieved in the first phase of complete decongestive therapy. It is important to understand that compression garments will not, by themselves, reduce swelling or edema and must never be worn on a swollen extremity. The correct choice of compression garment should only be made by a trained individual with a full understanding of the pathology of lymphedema and its related conditions. These individuals are either the lymphedema therapist, a trained and certified garment fitter, or the treating physician. Many potential problems and special needs of the individual patient must be considered and addressed in order to arrive at a comfortable and supportive garment solution. Ill-fitted and ineffective compression garments not only produce poor results, but can also be dangerous to the patient. Compression garments are available as sleeves, gauntlets, or stockings for the extremities, or brassieres and vests for the truncal portion of the body. They are manufactured in several sizes and variations, such as flat or circular knit. They are also available in several colors and can be ordered in standard sizes or be custom made. It is also very important that the correct compression level or compression class is chosen for each individual patient. Compression levels establish the compressive value the garments produce on the skin surface and are measured in millimeters of mercury. There are 4 levels, one being the lowest with 20 to 30 millimeters of mercury, and 4 the strongest compression with levels of over 50 millimeters of mercury. Compression classes 1 through 3 are available in custom and ready-made or off-the-shelf sizes, whereas compression level 4 can only be custom ordered. In order to determine the correct compression level, many factors must be considered, such as age, activity level, skin integrity, as well as possible comorbidities such as CHF or congestive heart failure, paralysis, or wound issues. Now, compression socks or anti-embolism stockings that are available in pharmacy chains such as Walgreens, CVS, or Walmart are not suitable to treat or maintain lymphedema. These garments have compression values of much less than 20 millimeters of mercury. Lymphedema requires a minimum of 20 millimeters of mercury. These support stockings or sleeves may provide some support that can be sufficient for swellings following minor injuries, such as sprains, but do not even come close to provide the support necessary to maintain the swelling associated with lymphedema. These support garments may be less expensive than compression garments, but they do not work. They simply do not contain lymphedema. Ineffective compression results in further complications, which are, in the case of lymphedema, completely unnecessary. Now, should you receive the advice from a healthcare provider to purchase an ineffective support garment versus a compression garment specifically geared towards the management of lymphedema, I would strongly recommend to terminate this relationship and seek consultation from a properly trained and certified lymphedema therapist. A healthcare provider familiar with the pathology of lymphedema would never recommend ineffective garments that can be found at the pharmacy stores I mentioned before. In order to locate a trained and certified lymphedema therapist in your area, you can go to www.lymphedemablog.com and click on the Find a Therapist button on the menu bar. Compression garments suitable for the management of lymphedema can be ordered through online providers such as lymphedemastore.com. If you need more information on all aspects concerning lymphedema, please go to lymphedemablog.com and click on any article of interest to you in the menu bar to the left of the homepage. Thank you. Stay well and healthy.